Absolutely. We've made the point that the most important figure moving forward is the rate of vaccination, and that remains the case. As soon as we hit all those milestones, we will have those extra freedoms, and we're looking forward as a team to announce tomorrow or the day after what life looks like in September for those who are fully vaccinated. This is really important message that no matter what the case numbers are doing, when you hit those high rates of vaccination, you're giving everybody protection. You're reducing the chance of the spread and you're keeping people out of hospital. And when you hit 70% double dose, as the Doherty report states, you start to transition into talking about the rate of hospitalisation, not the number of cases. The number of cases becomes less relevant. Now, I don't want to take away from the situation New South Wales is in, because every day we're working night and day to put downward pressure on those cases. Don't get me wrong. Every day we want to see case numbers go down, not go up. But moving forward, the most important number for us is how many people are protected, how many people have that suit of armour, because we know that keeps people out of hospital, it reduces their chance of being contagious, and it allows all of us to look forward to living life more freely. And that is really critical. As we said, we don't want people riding the roller coaster ride of cases going up and down. They will bounce around. They could go up, they could go down. But what we do need people to focus on is what you need to do to keep yourself safe, your family safe, and what all of us can do to reduce the spread, and that's really important.
How concerned are you that case numbers are now in the 900s? Because I think a lot of people would be quite alarmed by that.
Oh, look, there's no doubt that people would be alarmed with the rising case numbers, but it's, again, a mark of how well the vaccines work, that our hospitalisation rate is still relatively low. We don't want to see anybody in ICU, and we don't want Dr Morgan to have more patients she has to look after as a lung specialist. And we know the vaccines are our best way of doing that. Even last year when there was that outbreak in Victoria, even though they had fewer cases, the death rate was much higher because the tool of the vaccine wasn't around. So what is really important for us, what is the measure of how well we're doing, is keeping people out of hospital and stopping people dying. And that is the most important measure. But what is also really important is when you have those high rates of vaccination, that adds protection. It allows us to live life more freely and gives us confidence to move forward, because every state in the nation is going to have to confront having Delta part of our lives moving forward.
The hospital system, though, we know that Westmead overnight has shifted into emergency operations mode. They've ceased taking ambulances for 24 hours. They need 100 extra beds. It doesn't sound like it's necessarily coping. It's saying it's not business as usual anymore. How do people feel confident that the health system is going to be able to stand up if we're seeing this? And are other hospitals headed this way?
Look, I'll ask Minister Hazzard to comment on this point as well. But what is really important to note is that, as Dr Nguyen said earlier in the week, she's one of the specialists that manages capacity across the state. We have been working hard as a team across health, across government agencies, across government, to make sure we've increased our capacity to be able to deal with extra numbers of cases, and of course across the entire network. There's no doubt that parts of our hospital network are under severe pressure when most of the cases, when 80% of cases are coming out of the same region. Of course that's going to put pressure on local hospitals. And I'll ask Minister Hazzard to make comment on that as well. But we've been preparing for that increased capacity, for the increased equipment and staff and all those things we need, and we can't pretend a pandemic is easy. We can't pretend there isn't going to be pressure on the system. Of course there is, and that is ongoing. But everybody who needs medical attention will receive it.